I'm Dr. Langley. I'm a family medicine doctor and I work in a direct primary care practice, which means I work directly for my patients. I don't work for insurance companies. And that means I have longer appointments with them so I can make sure that I'm addressing all of their concerns. And one of the most common things I see musculoskeletal injury wise is pain in your neck. Even for people who aren't out there trying to tackle new sports or trying to get into faster times and just doing their regular exercises. I mean, there's all sorts of things that folks come in with neck pain, whether it's just sleeping on it wrong. I mean, I honestly don't have any pillow recommendations as often as I've been asked, or mattress recommendations. Everyone seems to find a different thing comfortable and good for their neck and good for their back. But it could be sleeping on it funny. It could be falling asleep on the couch. It could be just for no reason at all. For one reason, you just can't move your head in that certain position, can't tilt it, can't rotate it. So what are you supposed to do? This is a really common complaint that I see. So let's go over some things that should make you pursue higher levels of care, maybe calling your primary care physician, maybe even going to urgent care or the ER to see if something's actually really going wrong, or whether it's just the muscles in your neck spasming up, which is the most common thing, and how to get through that time of pain and difficulty and be able to do things like drive. Being able to look over your shoulder is really helpful for safe driving. So what are you supposed to do in the meantime? So first of all, let's talk about that. There's a lot of muscles running all the way up from the base of your skull here down all the way to your spine. They connect at all sorts of different levels. Your shoulders are very much connected to your neck, so all of that can be connected with your symptoms as well. So keep that in mind as you're evaluating how much of a limitation that you have. Go through the full ranges of motion. So bring your chin to your chest, see if that's affected. Try to look up at the ceiling, see if that causes you pain. Try tilting your head to either side, side bending it like that and that, looking over your shoulders to each direction to really get a feel for what motions are limited, which ones are causing pain. And if you notice that, hey, I do get a little bit tight with this motion, maybe work on stretching that a little bit, holding it there, trying to get a little bit more motion if that's not too painful. But again, just moving this shoulder might cause an increase in pain, might cause it to be different. So keep that in mind too. You might have to have help from someone else moving your head gently around, stretching it out a little bit. Those can all be beneficial. But things that you should be a little bit more worried about, kind of red flags when it comes to medical-ish phrases, would be things like weakness in your upper extremity or your legs, trouble with coordinating your walk, things that require balance. If that's being thrown off because something is going on with your neck, that's something to be concerned about. Another big red flag is bladder or bowel dysfunction. All of a sudden you're having a lot more trouble keeping your poop or your pee in where it's supposed to be or going when you need to. That's a big red flag. That's something to seek urgent care from. If you have like a shock-like numbness that comes over, especially when you bend your neck fully down to your chin to your chest there, that's more concerning. If you're having fevers, a temperature above 100.5, if you're having weight loss for no good reason, I mean, whether that's a good thing or a bad thing for you losing weight loss without trying is something that doesn't normally happen, and that is a concern. If you're having vision changes, whether that's double vision or having more blurry vision than you usually do, that's concerning. And pain that's in the front of your neck. I mean, you've got these big muscles, the sternocleidomastoids, that go from your sternum and your clavicles here, and they go up kind of behind your ears. Those are normal muscles that often you can kind of see them stand out if you bend your neck just the right way. And those ones can get tight, but anywhere else is unusual on the front of your neck. The back of your neck is common to have pain, and those muscles are common to have pain, but anywhere else is unusual, and maybe you should see your primary care doctor about that. So barring all that, you've got your typical neck pain. You can't move it in certain directions. It hurts, especially on the back. And especially if you try pressing on those muscles, you're like, oh, right there. That's the spot. That's where it hurts the most. Those are more of your typical neck pain, cervicalgia, muscle tightness type of pain, muscle spasm kind of pain. So doing those exact things that we've talked about already, stretching, gentle massage of those points, whether it's with your own hand or get a cool Theracane, which are kind of these big candy cane shaped things that help you to not tighten those muscles while you're trying to massage those muscles. Look it up on Amazon. It's pretty cool. Um, and then things like your basic over-the-counter medications, Tylenol, ibuprofen can be helpful. If Tylenol and ibuprofen aren't covering it, sometimes muscle relaxants can be prescribed, and those can be helpful. It's not like they're magical from what I've been reading lately about muscle relaxants. It really just kind of helps you sleep better, and that helps your muscles to maybe reset, but there's nothing magical about them of targeting those muscles and helping them to relax despite their name. Kind of a disappointing thing to learn. Oh well. It's a normal thing to have a residual tightness and pain for up to about 4 weeks is what I've been reading about. Anything more than 4 weeks, then we start to get more concerned that there's something else going on. But that is a long time. I mean, usually my patients get better in a week or two. I mean, they might have a little bit of residual tightness, but usually it gets better pretty fast. So 4 weeks is a long time to have this, and at that point I'd be saying we definitely need to get into physical therapy, seeing if we can get some help with that stretching, with that mobility, maybe dry needling, trigger point injections, massage, osteopathic manipulative therapy as a DO instead of an MD. That's something that I can do on my patients too, kind of gentle ways of forcing those muscles to relax. And even, I mean, from the very beginning, exercise is a good idea. I mean, it's not comfortable, so you might not be able to do what you usually do for exercise, but going for a walk is a great way to relax everything. Even if you can't be looking very quickly to either side of the sidewalk or path that you're walking along, it's still a good idea to get things in general kind of loosen up over the course of a walk. So that's a good thing for your neck as well. Things that don't work so well but are sometimes used, those cervical collars, if you've ever seen someone kind of strain their neck and use that lack of mobility is actually kind of a bad idea when your neck is acutely inflamed like that. Traction devices in general, pulling up on your spine, don't seem to have the evidence to be very helpful. Surgery should be avoided, especially if it's just an acute muscle spasm, so don't think that that's a quick fix. Botox injections don't seem to help that much in spite of the muscle spasm. That maybe it could be helpful for a long-term chronic issue, but for just these kinds of short-term injuries, not so much. TENS units, from what I was reading, maybe not particularly helpful, but also not too dangerous to give it a try either. I'll even do acupuncture sometimes, and sometimes that helps, sometimes it doesn't. I just do the kind that goes in the ear kind of acupuncture, battlefield acupuncture. So all things to think about. Even if you can't get a big degree of movement with your stretching, there's actually a connection between your eyes and your muscles, so that even if you can't move your head side to side, just looking in that direction that you can't move is actually causing the muscles to fire to help them to relax a little bit. So keep that in mind, is that if you don't feel like you can get any movement at all, try just doing little movements with your eyes, and that even can start heading you in the right direction towards getting that mobility back. Hopefully you learned something from this. Hopefully your neck will start feeling better if that's what's going on and that's why you happen to turn on to this video today. I think that this video here would also be interesting to you, talking about more musculoskeletal type injuries, and be sure to subscribe to our channel so that you can find out when we put out new content. Thanks for watching.